Alright, for today's video, we're doing a full mouth sequence. I got my Typodont. I got my 3 Meg-Shift. Hopefully that'll stay together. I was messing with them earlier. So I got the posterior, the bite wing, and the anterior, which I have set up because we're going to do that one first, and Meg-Shift tube head. Alright, so let's get started. Alright, so number 1, here's a sheet sequence. I don't know if that's important. So we're gonna start and we're gonna go in the order that they want us to, and we're gonna talk about receptor placement. We're gonna talk about the teeth you're gonna want to see, and you're gonna want to point your PID, your tube head. Whoop, that came off a little bit. So let's get started, shall we? Number 1, oh no, you're going to want to do, you're going to get your anterior bite tab, and you're going to want it the midline, and you're going to kind of want to get inside. You don't want to get around the gums, but you don't want to gag your patient, so you're kind of try to find that sweet spot. So number 1 is the maxillary right canine lateral incisor. That's quite a mouthful. So you're going to want to line up with that tooth right here. So the teeth that the receptor placement, you're going to want to center with the lateral canine contact point. The teeth you're going to want to see are the mesial and the apex of the canine, mesial, distal, and apex of the lateral incisor. So you're going to want him to bite down on that. There's that canine. So I'll do this one-handed, and you're going to want to point, because pretend this is the nose, and this is kind of around the cheeky area. So you're going to want to point from the corner of the nose. So pretend this is a nose, so you're going to, this little corner right here, you're going to kind of want to point and line that up with the corner of the nose. All right. Number 2, you're going to want to do the maxillary central incisor. So you're going to want to get these teeth. So you're definitely going to want to be, I don't know if I mentioned this earlier, but you want to be parallel with the teeth, if very possible. So you're going to want to center with the central incisor contact point, and the teeth you're going to want to see are the mesial, distal, and the apices. And just close that bad boy up. And the central ray, you're going to want the tip of the nose. So see if I can get that without having to, like that. This part would be his tip of his nose, so you're definitely going to be a more downward angle. Right in there, kind of. Number 3, you're going to want to do the maxillary left canine lateral incisor. So getting that other canine, use your anterior bite tab. You're going to want to get midline, that sweet spot right there, so you don't keep it parallel if you can. And the teeth you're going to want to see with this are the mesial and the apex of the canine, mesial, distal, and apex of the lateral incisor. And see if I don't want to get that in the corner of his mouth, if all possible. So he's biting down on that, keeping that up there. And this is the corner of the nose, so his nose is right here, so pretend that's the corner. See if I can get that. So move that over a little bit more. So trying to get that corner of the nose, it'd be a very downward angle. Number 4, you're going to want to do the mandibular left canine lateral incisor. I almost did the right side. That was bad. That was bad. Because this is so I'm going to do the left canine. So his canine's right there. So you're going to want to center it with the lateral canine contact point. And the teeth you're going to want to see are the distal of the lateral incisor and the mesial and the canine apices. So I'm going to have to pick this one up. And like I said, there's going to be a tongue in here, so you're going to try and push that tongue back a little bit. If they have tori, you might put a little bit on there, but your good best is going to try and push that tongue back if you can. So you're going to have him bite down. This will be a very L-U-P. You got, oh, might knock a few of his teeth out. That's dental care for you. Don't tell our patients. I can grab the, and the central ray is going to point down from the ala to the chin corner. So where my thumb is, if you can't see that, this is his chin would be right around here. So you're going to want to do it from the chin. It's going to be more of an upward angle. Don't know if I can express that enough. It's going to be very upwards. Let's see if I can pick up my camera. It's going to be very upwards. Okay. So we did number 4. Don't know why I put that there. That does not belong there. Now we're doing number 5, the mandibular central canine incisors. So we're going to do these. So you're going to want to hit the midline, definitely that midline. You're going to want to kind of push that tongue back if you can. Okay, so on this one, you're going to want to center with the central incisor contact point. And the teeth you're going to want to see are the mesial and distal of the central incisors and the mesial of the lateral incisor and apices. So you're going to have them bite down. Fabulous, darling. Normally in real life, this would not take out their teeth. So definitely, this would be very center-wise. Being very interesting to work with. And the center ray is going to point down from the chin, from the tip of the chin or the nose to the chin area. So I can get it to, but this is going to be very much so like that. Alright, next we're doing number 6 is the mandibular right canine lateral incisors. So we're going to do this side. Grab your anterior bite tab. Going to get it in that midline, that sweet spot right there. And on this one, you're going to want to center it with the lateral canine. And the teeth that you're going to want to see are the distal of the lateral incisor and the mesial of the canine, the apices. And you're going to point from the ala to the chin corner. So see if I can get it in there so you can see. Very much so. Like that. Whoop. Sorry, it accidentally landed on the book. Alright. Next. So, yep. Next is after the mandibular right canine lateral incisor. Number 7 would be the maxillary right premolar. So, say goodbye to him. These are in anterior bite tab. Normally this one is shaped like a staircase, but this will work just fine for now. On to, they call this the posterior one. So let me just attach him real quick. And it does matter which way you do it because you don't want the cord to go back down their throat. So this is going to go on the right side. So on the maxillary, which does matter. Alright. So number 7, the maxillary right premolar. Sorry, it came off a little bit. Alright, so you're going to want to center it on the second premolar. I'm just showing you with my hand. And the teeth you're going to want to see are the distal of the canine, the first and second premolar, the first molar, crown, and apices. So, again, I just want to second molar, you're gonna wanna center that. Midline, getting that sweet spot. Try to make it parallel as much as you can with the teeth. And bite down. He looks very distinguished, almost like he's smoking. No. Anyway, you're gonna want to point down from the pupil to the mid cheek area. So, like I said, this is his nose, so his cheek's gonna be right here. See if I can, see if I can hold it, much like that. Normally the PID, but that's the only thing holding that up. So, keep that back up. After number 7, we're gonna do number 8, which is the maxillary right molar. So we're just gonna scoot it a little back more. You're going to want to center it on the second molar, which would be this one. Normally there'll be a third one, but this typodont, he must have had dental work done. I got mine taken out too. It was pretty expensive. So center on the second premolar, and the teeth that you're gonna wanna see are the first, second molar, crown, and apices. So you're gonna wanna center it. Pretend like that's the center. You want to get in that midline. You're going to kind of want to push that tongue over a little bit. If they have tori, you can put it on the tongue a little bit, I think. Sorry, Kim, if that's wrong. So try to get it in there. Bite down. Oop. Oh. Huh. Wait, did I say the maxillary? Hold on. Yes, why am I doing it on the mandibular? Sorry about that. It won't happen again. I was wondering why the cord was going in the back of his throat. So this one right here. Center. And you're going to want to direct the center point down from the outer cathis, the corner of the eye, to the mid-cheek area. So pretend, like I said, this is his nose. There's like kind of a cheek area here. So you're going to want to point down. See if I can hold that. Maybe not. Ugh. Sorry. When they say outer eye, they mean from this eye. You want to be flat with the cheek when you're doing those, because when you don't do those, you get a really bad cone cut, which I used to get quite a bit before I figured that out. All right, number 8. I did that. I just did 8. I did the molar. Sorry. Okay, now we're doing the mandibular left premolar. So that would be this. And the reason they do it like this is because they don't want to have to flip this around, and it won't take so much time. So the mandibular premolar, you're going to want to center it on the second premolar. This one right here. I almost grabbed the wrong one. So I want to center it on that. And the teeth that you're going to want to see are the distal of the canine, first and second premolar, and the first molar, crown, and apices. So you're going to hold that down, and then you're going to point down from the pupil to the mid-mandibular area. So he's biting down on that. There's your little positioning one. Point down very much like so, or point like that. Line it up with the XCP. All right. Number 10 is the mandibular left molar. So we're just gonna shove it back here a little bit further. Get that midline if you can. You're going to want to center it on the second molar, which is this one. And the teeth that you're going to want to see are the first, second, third molar, crown, and apices. This typodont does not have his third molar. He got him, but never came with them. And you're going to bite down. Going to center that on there, bite down. Here you go. And you're going to want to point down from the outer cathis to the mid-mandibular area. So let me see if I can get the PID going down like that. There you go. Line it up just like so. And when you do molar ones, you want to definitely, you want to try and keep them very parallel with the teeth, kind of like that. With whichever tooth that you're focusing on, you want to keep it parallel, because if you go like that or like this, it'll be a very bad cone cut. I've learned that from experience. Number 11, I'm pretty sure we're on. Maxillary left premolar. So I think at this point, I'm gonna have to switch this out. Because if I do the maxillary left, yep, the cord will be going back down our throat. So I'm gonna switch this out real quick. Well, not switch it out, but you just have to, okay. That or I did switch it out and I forgot. Actually, I can't. It's late at night. I'm sorry. There we go. So now we're going to do the maxillary left premolar. So we're going on this side. You're going to want to center it on the second premolar. So this, I think it's, am I grabbing the right one? Yep. You want to get in that sweet pot right there. You're using this posterior tab. I don't know if I'm saying posterior tab every time, but this is the posterior tab. Get that midline, try to get parallel with that tooth. And the teeth that you're going to want to see in this one are the distal of the canine, first and second premolar, first molar, crown, apices. And the point of these shots, I'll explain in a minute. And they want to point your central ray, point from the pupil to the mid cheek area. So here's his nose, here's kind of his cheeky area. Oh, sorry about that. Get a point like that so that it lines up. But like I think I said in an earlier video, if you line it up with the teeth, you want to line it up as possibly straight with that tooth if you can. Okay. Oops, I think I lost my spot. I think we did maxillary left premolar, so now we're doing number 12, which is the maxillary molar. So that would be this one. So for this one, you're going to want to center it on the second molar. Oop, grabbed the wrong, I don't know. I grabbed for the one that was closest to me. So, like I said, midline. You're going to want to kind of push the tongue over a little bit for these, but you don't want to, like, gag them. Like I said, put it on their tongue if it's that uncomfortable, but we try to avoid doing that. And the teeth that you're going to want to see in this one, you're going to want to see the first, second, third molar, crown, and apices. So, right down. Oh. Wait, hold on. What? This is the, sorry, I think I got mixed up. Ugh, sorry. This is the maxillary, this is the mandibular. I got mixed up there for a second, I'm pretty sure. So we're doing the maxillary left molar like that, sorry about that. Bite down, much like that, and you're gonna have a little, there you go. And the central ray, you're gonna want to point down from the outer cathus, the outer eye, I'll show you on me in a second, to the mid cheek area. You're going to want to straight from there. So when they say the outer corner of the eye, I don't know if they mean this part of the eye. All right, so we did number 12, which is the maxillary left molar. Now we're doing the mandibular right molar. Premolar first. You always do premolar. Scoot that back a little bit. So my tooth is missing. I don't know where he went, or she. So like I said, midline, hit that sweet spot, stick it in there. And the teeth that you're gonna wanna see on this are you're gonna wanna center on the second canine, or the second premolar, I don't know why I said canine. You're gonna wanna put on the distal of the canine, not eye, but you're gonna wanna see the distal of the canine, the first and second premolars, and the first molar, crown, and apices. So get it nice and bitten down, and get your little PID. Oop, popped open. You wasn't supposed to do that. And you're gonna want to point the point down from the pupil to the mid mandibular a P. There we go. Much like so, if I can get it to pick up. It's a little, it's very, very, very hazy. All right. Number 14, mandibular right molar. So, deep right here. So, for the mandibular right molar, you're going to want to center it on the second molar. Like I said, push that tongue over. Bite down. The teeth that you're going to want to see are the first, second, third molar, crown, and apices. So you bite down in it again. Sorry, the tape's coming undone a little bit. Oh, there we go. Stay sweet. Stay sweet, sweet. And you're going to want to kind of line it up like this. Point down from the outer cathus to the mid-mandibular. So you're just going to, like I said, to avoid that cone cut, you're going to want to really, trying to get this close, but you're going to want to really parallel with that sensor. All right. Number 15. Ooh, we're getting on to my favorite ones. I like these because they don't hurt the patient as much, and I think they're a little bit easier to take. So say goodbye to the posterior bite tabs. Almost say hello to the bite wing ones. Now the other ones, the point of them was to see up in here mostly, and up in this area to like see the roots and stuff. Bite wings is mostly you want to see in between the teeth, and to see the just, you know, how they line up kind of. I like them. But obviously you need, the dentist decides what pictures they need. So let me just put this on real quick. Sorry, I'm Butterfingers over here. I tried taping them on, but they did not like to stay. All right. Bite wings. All right, number 15. The right premolar bite wings. So you got this. I'm pretty sure, I hope I put this in there correctly. I did not. Hold on, technical difficulties behind the scenes. Or maybe I did have it put in there right. I did have that put on right. I'm just gotta stop judging myself. All right. Maybe you did. Oh. So I had, okay, got it on right. Sorry, my bad. That was my bad. All right. So number 1, got the bite wings. One set up. We're gonna do the premolars first. Sorry. Premolars, so you're gonna place the anterior edge at the midline of the mandibular canine. That is a very weird way to say that, but I think what they're trying to say is you're going to want to put that between there. Much like that. And you're gonna, and the teeth that you're gonna want to see in this, I type it on his acting up a little bit. Oh no, I was reading, no, sorry, I read the molar one. Place the anterior edge at the middle of the mandibular canine. So definitely gonna wanna get that in there. And for this, you can definitely put more towards the midline of the mouth. So the teeth that you're going to want to see are the distal of the maxillary and mandibular canine, premolars, and the first molar in the occlusion. Because this one, like I said, you're going to want to see there. And the central ray is going to point down from the pupil of the eye to the occlusal plane. So this one you got to be very more in tune with how this plays out. Because you're going to see how I have that lined up. You're going to really want to see between those teeth. And you're going to want to point from the pupil of the eye to the occlusal plane. So, and definitely get between those contacts. Next, we're going to do the bite wing right molar. You're just going to push this one a little back, a little further. You're going to want to place the anterior edge at the middle of the mandibular second premolar. So you're going to want to kind of line it up like this. And the trick with this is you don't want, it doesn't really, I won't say it doesn't matter, but we can see the third molar. We don't want, for this one we want to make sure that there is no third molar, so we want to get a little bit of this area. If there was a third molar back here, we wouldn't necessarily need to get the edge of it, because we can see that with our bare eye. But we definitely want to get these teeth right here and this part right here, because we can't see in between the teeth. So we're going to line it up like so. Bite down. And then where you're going to point the central ray for the molar shot is point down from the outer corner of the eye to the occlusal plane. The outer corner of the eye. So for bite wings for molar shots, you're going to want to line it up straight. I'm going to show you on me because it's easier. You're going to want to put it straight with the corner of this part of the eye, and from the other one you're going to kind of want to line up, for premolars you kind of want to line up with that part of the eye. So just to try and shed a little light on that. Now we are going to do the bite wing, the left premolar side, and you don't have to change this up any for that, which is quite nice. So there you go, focus in. All right, so you're going to place the anterior edge at the middle of the mandibular canine. Get between those bad boys right there. You want the sensor in like that. The teeth and the areas that you're going to want to see are the distal of the maxillary and mandibular canine, premolars, and first molar in the occlusion. Pick it up. And where you see my finger, I would assume that'd be more of the outer part of the eye, maybe right here, which is kind of where you kind of want to line that up. And you're going to want to point down from the pupil of the eye to the occlusal plane. So definitely like that. And then number 18, the final in our series, would be the bite wing left. The bite wing left molar. So definitely over here. So, and for these, it doesn't matter for maxillary or mandibular because you're getting both of them. So don't freak out on But you do, when you do line stuff up, you do want to line it up with the mandibular part of the tooth and not the maxillary part, but they're both as equally important. So for the molar, place the anterior edge at the middle of the mandibular second premolar. Like I said, don't have to get, there's no that, but we want to make sure that there's the teeth that you're going to want to see are the maxillary and mandibular molar crowns and the occlusion. And you're going to want to point down from the outer corner of the eye to the occlusal plane. So let me just line that back up for you. Oh, there we go. That doesn't point out like that. You want it more pointing in. Oops. Let me try to get it a little nicer for you. It's got that, it's biting on that pencil, so he doesn't like that. Like that. So you got that nice area like that. You want to get that the central, and you're going to want to point down from the outer corner of the eye to the occlusal plane, kind of around there flat. So, yep, that about does it. 1 through 18, how to do a full mouth series. Hopefully you enjoyed it. Thank you for watching. Goodbye.